What is radiofrequency ablation for GERD? Imagine a tiny device that can help prevent serious health problems caused by long-term acid reflux. That's what radiofrequency ablation can do for some people with GERD-related issues. Radiofrequency ablation is a procedure used mainly to treat complications from gastroesophageal reflux disease, or GERD. It is not a cure for GERD itself but targets a specific problem called Barrett's esophagus. This condition happens when the lining of the esophagus changes due to constant acid exposure, increasing the risk of esophageal cancer. During the procedure, a doctor inserts a thin, flexible tube called an endoscope into your esophagus. This tube has a small device attached that delivers radiofrequency energy, which is a type of heat. The heat destroys the abnormal tissue in the esophagus lining. The whole process usually takes about 30 minutes and is done in an outpatient setting, meaning you can go home the same day. Radiofrequency ablation is especially helpful for people who have Barrett's esophagus with precancerous cells. By removing or destroying these cells, the procedure lowers the chance of developing esophageal cancer. It is often done in 1 or 2 sessions, with follow-up endoscopies to check how well the esophagus is healing. While RFA does not treat GERD directly, it addresses a serious complication that can develop from long-term acid reflux. If you have GERD and are worried about its complications, this procedure might be recommended if Barrett's esophagus is diagnosed. It offers a minimally invasive way to reduce the risk of cancer and improve long-term health. It is important to remember that RFA is part of managing GERD complications, not the primary treatment for acid reflux itself. Lifestyle changes, medications, and other therapies are still necessary to control GERD symptoms. But for those with Barrett's esophagus, RFA can be a helpful step in preventing more serious health issues down the line. In summary, radiofrequency ablation is a safe, outpatient procedure that destroys abnormal esophageal tissue caused by Barrett's esophagus. It is a valuable tool in reducing the risk of esophageal cancer for people living with long-term GERD complications.